Hi everyone. So I work for the Primary Care Liaison Service in Central Auckland, Te Tauka and the part of my role is to coordinate the Clozapine discharges to GP. So there's 4 nurse specialists working, 1 in each CMHC. And we have a small team of psychiatrists in our service, like probably just make up one whole person, literally. I'll just talk about Clozapine monitoring. So these are the criteria for people who we would think about discharging to GP care. So obviously we want to make sure they've got a stable mental state with no risk issues, i.e. hospitalisation, suicide attempts, self-harm or anything like that for at least 2 years. We want to make sure they're agreeable to going to the GP. Their family has to be in support of it, or their support people at the very least. They've had to have no hospital admissions or respite, which is part of a non-hospital service that we have for people who are really struggling, for at least 2 years. They need to be self-managing and monitoring their own treatment. So they need to go and collect the Clozapine from the pharmacy themselves. They need to go and get their monthly CBCs. They have to attend to 3 monthly mental health assessments at their CMHC. And they also monitor themselves for the adverse effects, of which you'll be aware there are quite a few. We don't want a Clozapine dose that has been changed at all for at least a year. And we need their white cell count to be in a normal range for the past year. So overall white cells and neutrophils. They have to be in stable accommodation, and any consideration of a dosage change once we have successfully discharged them to a GP, all you'd need to do is ring myself or one of my colleagues in PCL, and we would talk with a psychiatrist and talk about any kind of dosage change. So these are the steps. So the first step, because we're doing episodic care, even for people who are severely mentally ill, is that myself or one of the other nurse specialists at the CMHCs would contact the GP on the phone and discuss the level of comfort with the discharge. So we obviously are not saying that this person has to be discharged, because the GPs have to be comfortable with it as well. Sometimes a client is not enrolled with the GP, which happens quite a bit when they've been under a CMHC for a long time. So we would ask the key worker for the consumer to make sure they are enrolled and have some kind of GP relationship. And also we want to find out the current understanding your understanding of the Clozapine pathway, which is on health pathways. All this stuff is on health pathways. We want the GP to be vocationally registered. Sometimes if there isn't a GP who is vocationally registered in the practice, we can do some kind of thing where one who is can oversee. But ideally they should be vocationally registered. After the phone call, and if you're okay with it, then we do an initial letter with their mental health information, history, signs of when they're unwell, how they may have been when they were particularly unwell, and signs of becoming unwell, because obviously we need to keep track of that. Then we do an electronic letter with the actual information about Clozapine monitoring, all of which you can get on health pathways, but we also want it to be more personalised so that you get a letter from the nurse specialist about it, and who and how to contact mental health services with concerns. So the first point of contact for any concern, whether it be about the Clozapine or the person's mental health state, is the PCL nurse specialist. Then what we tend to do, with COVID we've had to do over the phone a bit, but now we're going back into the GP practices to do education sessions with the practice nurses and the staff there, which can take up to about 45 minutes depending on their level of understanding and what they need to know. If the person is in a rest home, for example, we would go to the rest home and do teaching sessions there as well. We do, the paperwork we need to complete is, we have an organisation called CareLink Plus, which is situated in Australia. They oversee the pharmaceutical companies here I think they're also in Australia too. And the one that we work with in Central Auckland is Viatris. So CareLink Plus oversees Viatris, and they're the company that monitor the person's Clozapine the CBC, if it's in any way derailed, you'll get a letter from them or a notification from them, and also that the person has picked up their medication as they should have. Even if the person's been out of CMHC for a number of years, we will still get the notifications about the CBCs and about whether they're picking up their Clozapine. So a person's never really completely out of our care, even if they've been with a GP practice for quite a while. Sorry, it's a bit busy. So during business hours, and I think this information is going to be sent out to everybody afterwards, yeah, so each different CMHC has a nurse attached, and that's the person you ring directly on our mobile with any questions. Out of business hours is the urgent response service. You know about the GP mental health line that we have that is manned by consultant psychiatrists every weekday, and that's to talk about anything, not just Clozapine, anything at all. So one of the main concerns we have with Clozapine is lethal constipation. So it says in the instructions on health pathways 5 days with no bowel movement, but we tend to go with 3 days really, because this is the leading cause of death in terms of Clozapine. So with a person who's on Clozapine, they need to be on a standing dose of some kind of like Senna, Colox or something like that, and then there might be PRN dosage if they haven't had a bowel movement for a few days. They can either get a stimulant suppository at the practice. If this can't be done for whatever reason, often it can't be, then you call an ambulance and they go to the ED. So the ED clinicians have a lot of experience with this. They contact the liaison psychiatry person or staff at Auckland Hospital once the person arrives. And, well, I used to work for liaison psychiatry for quite a while, so I know that we do come down and we see the person. We'd also see them up in the wards. So anyone who's on Clozapine for any reason, comes to hospital for any reason, is always seen by the liaison psychiatry team, because often the medical teams there don't really feel comfortable with Clozapine. So in any of the other problems too, like agranulocytosis, you call us and we'll discuss it with the haematology consultant, and we talk to our own psychiatrist about it. And suspected cardiomyopathy, again, you call us. And again, the Regional Health Pathways website has all this information too. So one of the questions we were asked to speak about was this, but also about nurse practitioners prescribing Clozapine. In New Zealand, nurse practitioners are not allowed to prescribe Clozapine unless they're in a CMHC and it's under a psychiatrist. So that's not going to be a thing. They just can't prescribe it in the community, in a GP setting. So this came out in 2020. We know that Clozapine levels can increase during periods of acute affection. We know that obviously raised Clozapine levels are associated with Clozapine toxicity. So that would be fever, low blood pressure, dystonias. It's quite obvious if somebody has Clozapine toxicity, including sedation, myoclonus. And when we come and give the talks to the staff at the GP practice, we talk about this as well. So anyone on Clozapine who develops COVID-19, if they are already smoking, and a lot of our people are smoking because it helps them to concentrate, and if they stop smoking because they're unwell, this may also lead to an increased Clozapine level. So you've got the COVID-19 infection and you've got the possibility of them stopping cigarettes. And it's the actual inhalation, it's not the nicotine that causes the Clozapine levels to change. So we need to do a Clozapine level in a person with COVID-19, and we'd also do a CBC. As soon as you find out, you do a CBC to check their neutrophils. And if we were looking at lowering a dose of Clozapine, that's something that PCL would do. So the main takeaway is that if you've got somebody on Clozapine, they develop COVID-19, you just ring us straight away and we will take over and help with that. So that's the main takeaway really, you just call us if there's any problems at all.